Greetings, California. My name is Eliana Ramirez. I am the director of the Crisis and Recovery Enhancement Care TA Center. I am here with my colleagues, Kristen Smith, Sylvia Tang, and Mego Lien. These are incredible, hardworking folks from behavioral health departments in counties across the state of California who have been working, rolling out some very exciting training to the community regarding culturally responsive suicide prevention and mental health 101, which is referred to as Be Sensitive, Be Brave, BSBB. And today we're going to have a short conversation with these colleagues about their experiences developing and rolling out BSBB in case you, as an Ethnic Services Manager, Mental Health Services Act MHSA coordinator, or suicide prevention coordinator at a California county across the state, or MHSA funded city jurisdiction, might also be interested in implementing BSBB locally. So with that, I would like to go ahead and start off with my colleague, Mego. Mego, would you mind sharing with us a little bit about your work, your county's work with Dr. Joyce Chu and colleagues working on BSBB, please?
Sure, yes, I am Mego Lien. I'm a Prevention Services Division Manager with Santa Clara County Behavioral Health Services. And I've been in this role for about a year now. Prior to this, I managed the suicide prevention program for Santa Clara County. And now in the Prevention Services Division, I have suicide prevention and substance use prevention in my division. So we really created the BSBB training in partnership with Dr. Joyce Chu's team at Palo Alto University. The way this came about was we had a contract with PAU and Dr. Chu to do a full-on cultural competency review of all of our suicide prevention program materials against what's called the cultural theory or model of suicide that was developed by Dr. Chu and her colleagues. Really looking at cultural competency and how culture affects different aspects of suicidality. We wanted to update our trainings as part of this review. So we were looking at training materials, our public awareness communication materials, our outreach brochures, all through a cultural lens, and decided through this kind of review that we wanted to update the various trainings that we were offering through the program. We call them traditionally gatekeeper trainings, but in the process, we've changed the way we refer to them to community helper trainings. So I'm going to call them community helper trainings for the rest of this recording. And so we started approaching different training companies, your Living Works, your QPR Institute, and Cognito as well. And we had mixed success with different companies in terms of incorporating cultural aspects into their existing training curricula. And so we were able to work with different companies to incorporate components of the cultural theory, but we also decided through that experience that we would go out and create and test our own community helper trainings, both as an introduction to mental health and one training for suicide prevention. This was also a way for us at the program level to be able to make more efficient use of our resources. So frankly, that we wouldn't have to use as much of our funding on trainers and buying training materials. We could essentially create almost an open source kind of community helper training that would be available to other, suicide prevention programs as well. So what Dr. Chu's team went about doing was identifying, they had done a review of all of these different gatekeeper or community helper trainings, and they identified a number of what they're calling gold standard components of community helper trainings. They then added on the cultural lens using the cultural theory and model, and this really became the foundation for the curriculum for both Be Sensitive, Be Brave mental health version, and then the BSBB suicide prevention version. So I'll just stop there. There's a lot more we can talk about, but that's really where it all started from.
Thank you so much for taking the time to explain that background and the development of BSBB. It is a huge offer to the state that you put this together with Dr. Chu and her colleagues, especially right now in 2022, when we are seeing so many communities experiencing disproportionate behavioral health challenges with the pandemic, with wildfires, with so many different issues that are going on. And so I'm really excited to hear from our additional colleagues about implementing BSBB locally. And we'll go next to Kristen Smith. Kristen, would you please start off by telling us a little bit about why you decided to implement BSBB in your county?
Wonderful. Thank you so much. So my name is Kristen Smith. I'm a senior health education specialist with the Suicide and Violence Prevention Program with Humboldt County Public Health through Department of Health and Human Services. And we have offered a variety of suicide prevention and mental health awareness trainings in the past. We've offered QPR, Assist, Living Work Start, mental health first aid, et cetera. And we'll still continue to offer some of those, but we also know that these trainings, learning, it's not a one size fits all. And a lot of training participants would have questions that specifically about culture. And so when we learned about the BSBB trainings, we were pretty excited about that. As an organization, we've taken a lot of steps to prioritize equity across all branches, and make sure that training is part of that. It's accessible to everyone, and the information is accessible to everyone. So, acknowledgement and awareness of one's cultural identities, how those identities intersect, what types of social inequities might a person face, all of these things really play a big role in the way that we connect and support a person. So it was really a priority for us. And when we learned that that's part of BSBB, we're again very excited about that. And also, a lot of agencies were really, seeking training that for their staff that was tailored to a particular group. So whether it was, a culture based on race or ethnicity, or if it's a culture based on gender or age, like foster youth or LGBTQ plus, it was a little bit difficult to offer tailored trainings. So it was really nice to implement BSBB to be able to learn and teach and share a method of applying a cultural lens that's a little bit more flexible, so it could be effective, in a different type of in different types of cultural contexts. So bottom line, we really wanted people to learn those skills or steps of suicide prevention and mental health awareness. That's straightforward and easy to remember, but also how to take that recipe and make it person-centered and culturally sensitive when applying those steps. And that's really what BSBB was and is. And so we really enjoy it for that reason. And we're also very invested in the clinical training offered by Dr. Chu and Dr. Weaver, the Suicide 201. So it made sense to offer BSBB as well. Thank you.
Phenomenal. Thank you so much, Kristen. And so we started off in Santa Clara County, then we went up north up to Humboldt County, and now we're coming back down to San Mateo County. I'm so excited to introduce Sylvia Tang. Sylvia, would you share with us a little bit about how your county decided to bring BSBB in, please?
Yeah, absolutely. So thank you for inviting me to speak with our sibling counties here, and big shout out to Dr. Chu for co-creating this with Santa Clara County and Mego's team. Just to introduce myself, I'm Sylvia Tang. I use she, her pronouns, and I work for San Mateo County Behavioral Health and Recovery Services Office of Diversity and Equity. So we, in our office, we come with this lens for equity and cultural responsiveness all the time. And in my work, I work on suicide prevention and reducing stigma around behavioral health. And so definitely want to bring that equity lens to the suicide prevention work. And I feel like a lot of us are paving the way because it's we're figuring this out as we go, but we're so lucky to have Be Sensitive, Be Brave as a resource for that. So how this came to be, at least for our county, and how we started to implement it was, we were working on our second strategic plan that we call a roadmap, the suicide prevention roadmap, and we were doing the data, analyzing. So we were working closely with our epidemiologists who are really helpful during the pandemic, and before and after, but especially during the pandemic, they were monitoring suicide deaths and seeing if it was going up during the 2020, specifically the first year. And they did see an increase in suicide deaths among two groups that stuck out. One was white women due to overdose, and two was Asian males that were born outside of the U.S. Specifically, a lot of the main countries were China, Hong Kong, and the Philippines. So it was really alarming to see that, and we were trying to address the needs for both groups. And I approached, specifically for the second group, the Asian males born outside the U.S., I approached Dr. Chu because I know Dr. Chu is an expert in, cultural psychology, cultural suicidology, and also, just for Asian American behavioral health expert as well. So I approached Dr. Chu just to brainstorm with her first, and I learned about this training that I think I knew because I've talked to Mego many times we're neighbors and partners, but I didn't really realize how amazing this training was. So Dr. Chu was telling me how it's, the foundation is based on the theory, and that it's recently just at that point when we were talking, it was recently, I think the pilot was completed and they were ready to move on to a second stage. They just finished the pilot for the English. So Dr. Chu proposed the idea of what about adapting it for these different Asian communities that you're seeing a need in right now. So specifically, we were thinking of Chinese immigrants from China, and Tagalog for immigrants coming from the Philippines. So we wanted to start working on both of those. And we turned out starting with Chinese because we had partners that were ready, and also because Dr. Chu felt, as a Chinese American herself, she felt comfortable starting there for the pilot adaptation. So it's been a really awesome process, but that's where we started. And we're, hopefully in the next fiscal year, we're hoping to also adapt for the Tagalog-speaking Filipino community and Samoan and Tongan-speaking Pacific Islander communities. And as Mego said, this would be open to anyone who's interested, even though it was adapted in our county. I think that's all I wanted to say about how it got started. So I'll stop there.
I really appreciate you sharing that information, Sylvia. And to all three of you, Mego, Sylvia, Kristen, if no one has said so today, thank you. Thank you so much for working on these important issues at a county level across California. We are so fortunate to have you as deep thinkers about these issues and bringing in people and resources that are culturally specific. I know, Mego, there was something else that you wanted to add in as well, please.
Yeah, I wanted to pick up on something that Kristen mentioned about why her county picked up on BSBB. So just thinking about this sort of like efficiency programmatic issue that, especially in such a diverse county and state as Santa Clara County in California, it's virtually impossible to get a training group of a single culture. You're always going to be having participants that have multiple backgrounds, cultural backgrounds that are coming to the table. And so it is nearly impossible to say, okay, I'm going to have this training for this particular group and this training for this particular group. And so the beauty of the cultural model, which was the foundation for the BSBB training, is that it summarizes years of research on culture and suicide and kind of boils it down into 3 or 4 tenets that apply across cultural minority groups. And so, of course, the BSBB training can be tailored, as Sylvia and them are doing in San Mateo County, to specific groups using specific examples that apply to cultures, but the broad concepts still apply across cultural minority groups. And so it really helps to address that programmatic issue of how are you going to have a different training for all these different groups. So I was really thrilled to hear that Humboldt County picked up on that, and it's one of the main reasons they were interested in BSBB.
Thank you so much for that additional information, Mego. I think that when people who join the county behavioral health departments, or perhaps they work at Veterans Affairs or at a vet center or some other a place where they're focusing on suicide prevention, or they're focusing on behavioral health disparities that are impacting different communities, as an ethnic services manager might at the county behavioral health department level, some people have been in this work for quite a while, and some people are a little bit newer to the work. So it's really helpful to have that kind of framework for thinking about the SBB and how you can tailor it to specific communities and or roll it out for all of the communities that are local, using 3 or 4 tenets that tend to go across. And just a shout out to Dr. Chu, I have been a fan of her work for many years. She is phenomenal. And the work that she's done, meta-analysis, looking at research regarding suicidality, suicidal crises, pre and postvention across diverse communities for many years, has just been really the gold standard, and helping us to think about how some of the kind of mainstream suicide prevention, whether it is a standardized assessment tool or it's an intervention, have really tended to think only in terms of certain cultural groups. So we're asking about certain types of behavioral health crises or other feelings. But when we start to look more specifically at different communities, maybe it's not the feeling of depression or sadness, but maybe it's a feeling of shame. That some of her research has identified that with some Asian ancestry communities, for example. And so it's very important pieces like that we need to start thinking about from a culturally specific community. And Kristen had mentioned also about the LGBTQ community as another distinct cultural group. And when we think about this from an intersectional perspective, we see that we have LGBTQ people who are also people of color, who are also immigrants, and so on. And so we really do need to think in a critical way about the complexity of our communities. Speaking about the complexity, and there are different ways to kind of approach BSBB. So for our audience, if anyone's thinking, oh, this sounds really interesting, well, what's the next step and what are the kinds of resources that might be available? I'm aware that there are at least 2 options. There might be more that I would invite you to share, but one is to think about doing a train the trainer. So identifying some local folks who could be trained in BSBB plus. So they would be the folks who would go out and train the community, or you could just offer BSBB directly to community members. So I would like to go through our panel here and invite you all to share a little bit about which avenue you decided to go to bring the training directly into your community, or if you decided to train some of your local folks who would then be able to roll out the training in your community, and kind of why you decided those different ways of going. So we'll start off with Mego again, please.
Sure. So because we were developing the training and we wanted to pilot it in the very beginning, I think this was about 4 years ago at this point, we started with a team of Palo Alto University students who were on Dr. Chu's team, as well as the suicide prevention program staff. So all of us got trained in the initial versions of BSBB, and then we went out doing just small pilot trainings, and were able to kind of refine the curriculum that way. Then after that, maybe a year after, Dr. Chu's team then created the training of trainers, all of the materials that are associated with both trainings. And I think it was last year that we just started delivering the TOT to cohorts. But we really found that the supply of trainers that we had was really not keeping up with the demand. And so just this year, we are thinking about different ways to increase our trainer pool, really. So we're doing that in a few different ways. So, the program staff are trained for sure, but through partnership, especially with San Mateo County and Sylvia and team, we're able to get access to some of the trainers that they are going to be training. I'm sure she'll talk more about that. And then beginning with fiscal year 24, we're going to start working in the BSBB training into our contracts with different providers and asking them to start giving the training as well. So those are a few of the kind of tactics that we're doing to expand our trainer pool.
Phenomenal. Oh my gosh, thank you. I wasn't anticipating that you would talk about that sharing of resources between counties, but I know especially some of our counties that are more rural or have fewer CBOs or resources, that's a really important strategy. And here you are, Santa Clara County and San Mateo, not at all rural, and counties that tend to have more resources, but even locally for you both, that's been an approach that's really worked well. That's phenomenal. Thank you for sharing that. We'll go next to Kristen. Kristen, would you mind sharing about how your county approached this?
Sure. So Humboldt County is definitely very rural. We actually didn't hear or know about the BSBB trainings until this year. I learned about them during the Striving for Zero Learning Collaborative. And so it's pretty new for us. So we at this time have just brought BSBB to community members directly. And then as we kind of familiarize our community with it a little bit more, we'll be looking at possibly train the trainer, going to a T4T and having local people provide the training when we plan our scope of work for the next year.
Thank you so much for that, Kristen. This is a really great, another example of how if a county is interested in looking forward to rolling out BSBB, there's not one necessarily perfect way to do it. You can try it out in one direction and think about planning out a little bit further. I love that you and Mego, both have talked about writing this into plans, or maybe it was Sylvia who shared that as well. So this idea of institutionalizing the next steps as well is phenomenal. Let's go to Sylvia next. Sylvia, would you share a little bit about what you have done locally, please?
Yeah, happy to share. Yeah, so just piggybacking, just adding a little more to what Mego said, and also let me answer your question in general. Are we doing the train the trainer or community trainings for community members? We're doing a mix of both. So we are working with Dr. Joyce Chu's organization to provide the trainings to the community. Her organization has helped us in September, Suicide Prevention Month last year. And then we really rolled it out more this year due to a grant, and we'll probably get to that question later. But we're also doing a train the trainer this spring, and we're aiming for 10 folks. We turned out getting 9, and we might train that 10th person a little later this year. So we're hoping to get about 10 folks trained this year, and it's a mix of community-based organizations like our local crisis center. Some staff there are getting trained. Some of our staff at the county are getting trained, and I'm probably forgetting others. We have some previous mental health first aid instructors that are getting trained in this curriculum, and then some other folks that are part of our what we call health equity initiatives, coalitions that are serving marginalized communities. Yeah, so I hope that answers your question.
It does, plus some. I am so appreciative all of you have been doing this. You keep dropping additional pearls into this conversation mix here. I love that you're talking about bringing in local CBOs as well as some of your county behavioral health staff and folks who are part of your equity committee and work groups and divisions within your county. This is an exceptional example of that really critical relationship coalition building between these different places. For our communities of color, for our communities who speak languages other than English, for our immigrant communities, many times they will go to that local community-based organization before they come to the county. And so having those deep relationships between the county and the CBOs is so critical to addressing behavioral health disparities. And it sounds like also you mentioned bringing in folks who are trained in mental health first aid. I really love that this curriculum was created for people who are not necessarily clinicians. And in so many of our communities, unfortunately, if we have experienced systems that maybe are not culturally responsive, or maybe they don't provide services in our primary language, we might hesitate to go to those places at first when we're experiencing a behavioral health crisis, like a suicidal crisis in our family or neighborhood or community. But we do tend to go to our tias, our aunties, or we might go to the person that we're very familiar with in the neighborhood. And so it's such a beautiful way to think about the crisis continuum of care, especially for our diverse communities, going beyond what we tend to think of as crisis services. It's those informal networks that oftentimes are the places where it's really important for us to also roll this information out. So this takes us to the business side of it as well. And Sylvia, you kind of mentioned this a second ago. I wonder if you each would talk a little bit about how you funded BSBB, because I know that's a big question that will come up for a number of people. We'll start off with Mego. Would you talk a little bit about how you funded BSBB, please?
Sure. So the suicide prevention program in Santa Clara County is entirely funded through MHSA PEI funds, Prevention Early Intervention funds. So all of the development and initial work with Dr. Chu and team was funded through MHSA. But the work that I was talking about expanding to other contract providers to have them start offering BSBB as trainers, we've been doing a lot of work in our prevention division on kind of blending funding and merging efforts with suicide prevention and substance use prevention. And so I was able to identify SABG funds, Substance Abuse Block Grant, primary prevention funds. And those are the ones that are going to go to these CBOs and contract providers in the next year or so for them to deliver the trainings.
Thank you, Mego. This is exceptional. I really appreciate you talking about the braided funding and thinking creatively. And it reminds me about what Kristen was just mentioning, that in LGBTQ communities, and also Sylvia mentioned it earlier as well, that some of the higher rates of suicidal death are related to white women and overdose. And so we really this is a perfect place to bring in both the mental health side and the substance use side. And I know in the LGBTQ communities, oftentimes we do see higher rates of overdose that are related to substance use and overdose as well. So let's go over to Kristen. Kristen, how has your county funded BSBB, please?
Sure. In Humboldt County, we are using Mental Health Services Act prevention and early intervention funds primarily.
Excellent, thank you. And Sylvia, how is your county funding this? Oh, sorry, we've lost your mic there for a second. It'll come back up and let's try it now.
Thank you. Okay. So it's a mix of funding, but we also, like the other counties, are, so we have some participant trainings and the adaptation work we're doing for the Chinese community, that's being funded by MHSA Prevention Early Intervention, specifically under suicide prevention. And then we have a second bucket of funding that we received December 2021, and that's really helping us expand our capacity. So in addition to more participant trainings, that's funding the Train the Trainer. So this funding is, I'm forgetting what the acronym stands for, but it's called CRSA. It's for the COVID response funding from the state. It's under the mental health block grant funding. So that funding is helping us expand through the Train the Trainers and more participant trainings.
Excellent. Thank you, Sylvia, for this information as well. So you had talked just a moment ago, Sylvia, about some of the funding that was specifically related to Chinese community. And we're actually going to go to that topic next, which is if we would describe who the community members are who have participated in BSBB. In particular, how did you identify, outreach to them, recruit their participation? And so Sylvia shared a little bit about having folks from CBOs as well as MHSA, mental health first aid folks who are trained in that area, as well as people from the county. But who else have you all had from the community specifically who have participated in BSBB, and how did you bring them in? We'll start off with you, Mego, please.
Well, our program used to use, I guess I won't name it, a different community helper training. And so the program's been around for 10 years, since 2009, I believe. And so we have a really long history of outreach, especially, and we would get requests from our different outreach efforts, or people would find us from Googling online or through word of mouth. And so we started recommending BSBB and trying to kind of convert people from the prior community helper training and really selling that cultural sensitivity aspect to it, and found that there was a lot of demand for this, and well, people really welcomed the cultural aspect of the training. So a couple examples from when we first developed BSBB. The Nepalese community in Santa Clara County actually approached me. I think it was in the beginning of the COVID pandemic, actually, and they were really concerned that their community was seeing higher levels of depression and anxiety about the pandemic and not getting a lot of information about COVID. So mental health was really a concern, and I think they had experienced a few youth suicides as well in their really, really tiny community. So it had a really reverberating impact. So we had just started developing BSBB at that time, and were able to pilot it with the Nepalese community. And then in terms of direct outreach, example of that is that we reached out to the Tzu Chi Taiwanese Buddhist Foundation based in San Jose. And they were very open to bringing in mental health training for their youth as well. So with Dr. Chu's team, we did a full day of trainings with so many different groups. It was kind of a blur. I can't even remember at this point. I think we trained more than 100 Taiwanese American youth that day in partnership with this Buddhist foundation. And I also want to note that for some of these cultural communities where there may be higher levels of stigma around mental health and suicide, or there just isn't preparedness right away to start talking about suicide, the BSBB mental health training is a really good lead-in for those cultural communities. Like with the Taiwanese community that I mentioned, they were a little bit skittish about talking and leading right in with their youth about suicide. So we really introduced the mental health training first. So I think the pairing of the two BSBB trainings is helpful for outreach efforts as well.
Thank you so much for sharing that. That really resonates, the idea that we need to even approach the topic from a culturally specific perspective in the first place, and to not necessarily in all communities just jump into talking about suicide prevention, but there's this phenomenal mental health 101 training as well that's part of BSBB. Thank you for that, Mego. And you also talked about both the Nepalese community contacting you and you also reaching out to a Buddhist community in particular. So there's some institutional outreach that you've done in San Jose. Phenomenal. Thank you. Kristen, would you share with us a little bit, please, about how the community has become involved in your BSBB training, please?
Sure. So if, just to preface this, we haven't done a BSBB training for trainers. If I was promoting and recruiting for that, I would go about it a little bit differently. But just to promote and recruit involvement in the training itself, we started off with just lots of word of mouth, talking about it in coalition meetings. Also, we have a lot of community-based organizations, those serving Latinx community, youth, elders, family resource centers, tribal agencies, educators, generally 6 through 12, and collegiate, because we have Cal Poly Humboldt, public health, behavioral health, social services, healthcare staff, from front desk staff to lots of case managers and even handfuls of clinicians, and peer support specialists. So lots of variety in the people who have participated. The way that we promote BSBB in really any training, it really, for us, it starts with a flyer, that is hyperlinked. We put the QR code on there. We always make social media tiles so that we can encourage sharing. And we send out an announcement through our bulk list serve. Right now we're using MailChimp for that. And we announce all of those details in that bulk email, and that goes out to a lot of our local coalitions. And our local Suicide Prevention Network coalition is really a great cross-sector representation of our community. So we often will ask them to also reshare the information so it gets shared more broadly. And then for any trainings that aren't capped, we kind of take promotion just a little bit further, and we send out we have a Northern California Association of Nonprofits here, so we can send out information through their listservs. And we've, promote also through internally DHHS listservs, and through our county office of education has been a great way to promote BSBB. Of course, through tribal agencies, we have contacts at the VA. And then another great way to promote has been through our MHSA coordinator and ethnic service managers. They have to go out and do community facing work a lot in terms of getting feedback on the MHSA plan. So their listservs are pretty broad. So that's been a great way for us to promote BSBB so far.
That is so helpful to hear the really nuts and bolts and incredibly wide variety of approaches that you take to outreach. Thank you so much for that, Kristen. Let's go to Sylvia, please, in San Mateo.
Yeah, that's all really great outreach work being done in Santa Clara and Humboldt. And in San Mateo County, obviously we tried to outreach to the Chinese community as we were doing the adaptation work. And also the grant that we received, the COVID response grant, we really, in the grant, we requested to prioritize certain groups that whose mental health was particularly affected by the pandemic, including people of color, unpaid caregivers, healthcare workers, and adults interacting with youth and young adults with mental health conditions. So, that was who we were trying to prioritize at the time. But of course, this training is open to the general community as well. And how we did that outreach. So in terms of, I think number one thing we started with was champions, like our champions for this work, who can really help us. Those champions, those folks who can be our ambassadors. We were trying to introduce the trainings to those folks. So, we have the Suicide Prevention Committee, as do many of our counties do. So we had our coalition. So we had our coalition. We had a training for our coalition, but also open to the general community, and we started there this year. And also in our coalition, we have co-chairing with me is our Crisis Center director. So having the Crisis Center was important for as a key champion as well. We also had peers, those with lived experience as suicide attempt survivors or suicide loss survivors, or folks with lived experience with mental health, substance use conditions in general. We had training specific for peers. So we have a few peer organizations in our county, and had training specific for the peer group. And I mentioned health equity initiatives we have in San Mateo County. So we definitely reached out to health equity initiatives and those coalitions. And a couple more I want to mention is our libraries are wonderful. We have a very fond partnership with our libraries, and they're just such an important space and role in our community, especially for marginalized communities. So they were super helpful. And then lastly but not least is our mayors. This year, our mayors started came together to start what is called the San Mateo County Mayor's Mental Health Initiative, and they started it in January. And we have 20 cities in our county, officially 20 cities, not including unincorporated areas. So 12 of our 20 mayors or cities are part of that initiative, and they've been really helpful in reaching a broader audience. And then in terms of the Chinese community, just to give folks an example of the outreach we did for a specific community, we definitely leaned on Santa Clara County and Mego's team because, we are still struggling to outreach to the Chinese community here, and we're trying to learn how to do that better. And we definitely help spread the word with Santa Clara County and Alameda and our neighboring counties. There's an association, I believe it's not just Bay Area, it's probably statewide or beyond, led by Elaine Pang, is Mental Health Association for Chinese Communities. I see Heliana nodding your head, so you know. So Elaine's organization is amazing, and she and her staff really helped promote this training as well. We reached out to local hospitals that serve a large Asian Pacific Islander community, Northeast Medical Services. And we also we were so lucky to have a high school student help us too from Mills High School, and helped us get an article in their school newspaper, which actually got a lot of personal emails from. So that really helped a lot. That high school in particular has a large Chinese community. So that was really intentional why we reached to them, and we were lucky that they were willing to partner with us.
Oh my goodness, wow. It's incredible. It's incredible to hear about the variety of places where you have done outreach. And yes, I am a huge fan of Elaine's work as well. In fact, she and colleagues just recently did a presentation on the Orange Patrol for CARE TA Center. So these are people who volunteer to walk the streets of Oakland to interrupt situations of anti-Asian hate crimes, but also to step in to support people who are experiencing behavioral health crises on the street. And I think that her agency's work is another phenomenal example of how so many of our communities are doing the organizing in and among ourselves to address the needs that are coming up right now for our communities. And it's really, really powerful to hear you also talking about, Sylvia, the young person at the high school who wrote a newspaper article and how that really brought folks in, and your work with the libraries and the mayors. And then also, again, just really want to reiterate how incredible it is to hear about counties working with one another and building off of each other's lessons learned. We are at time here, but I do want to be respectful of your time and also create an opportunity if there's one or two things that you'd like to share about reflections from the community who have taken BSBB as just a final closing to the audience. We'll start off with Mego, please.
Sure. Well, we do pre and post surveys for all of our trainings, and then compile all of that data and analyze it on an annual basis. And this is across our community helper training. So we've developed, I think it's 8 to 10 measures that we ask across, the same measures asked across all of our trainings. When I think it was last year when we compared the performance on these measures pre to post across our different trainings, the BSBBs performed as well or exceeded in many cases the measures when compared with other trainings like youth mental health first aid, assist, QPR, and Cognito. Those are kind of the main ones that we offer in our program. And then in terms of qualitative feedback, I just really love the ones specific to culture. We get feedback constantly, you know, people saying that they have a better understanding about taking into consideration intersectional identities through this work, and a better understanding of how the influences that various cultures can have on a person's concept of suicide and their willingness to seek help. So we really have reinforcement both quantitatively and qualitatively that this is a really effective training.
Thank you, Mego. That's exceptional. Thank you. Kristen, are there any comments that you'd like to share from folks that you've engaged with?
Sure, I'll just quickly share two direct quotes here from participants. One person said, "I really love the recipe activity from the BSBB for mental health training. I work with educators and have already used this with them." And another person said, and this was about the BSBB for suicide prevention, this person said, "I hadn't really thought about how different warning signs might look when considering a person's culture." And I'll leave it at that.
Excellent, Kristen. Thank you. And we'll go to Sylvia, please.
Thank you. I want to emphasize how I'm such a big fan of this training, and I think our county is as well, and the participants who've taken it. You know, like Mego was pointing out to the data, it's a very strong community helper training in general, but it's also very unique to have this foundation of the cultural responsiveness and being underlined with this model. And what we've seen through the adaptation process is a lot of the content isn't changing. The content is very solid, but it's just some of the little tweaks here and there of how it's delivered or process-wise that we're adapting. But really the content is so solid for the English, and when it gets adapted elsewhere, that It's a very special training, and to my knowledge, it's the only training that's adapted in such a cultural responsive way and comprehensive way. I think first ever to my knowledge, but maybe Mego and Dr. Chu will know how to phrase that correctly. But I think it's one of a kind and one of the first. So I think it's a very special training, and hope the audience here can take the training soon.
That was a perfect concluding statement from our panelists. Sylvia, Mego, and Kristen, thank you all so very, very much for being on this panel and sharing a little bit about your county's experiences rolling out Be Sensitive, Be Brave locally. For our audience your interest might be piqued a little bit, we're offering the training to you at the Crisis and Recovery Enhancement CARE TA Center virtual conference coming up June 29th, 2022. We're sharing the entire training, both the Mental Health 101 and Suicide Prevention 101, so that you can take it to see what it would be like to roll it out at your county. The exciting part about this is that, again, you can roll it out locally. You can train your own staff to become trainer of the trainers, or you can just roll it out with the staff that are part of BSBB. And we are not paid by BSBB to do this info. We are just sharing this out with you because we know that many counties are wanting to take a culturally responsive approach to thinking about suicide prevention. And this is not only a curriculum that's come from and within California based on national data and research over many decades, but also is frankly a very affordable way to do this training. I have checked out many of the major suicide prevention trainings that are out there, and it really is to the credit of the authors of this training that they are intentionally keeping it very accessible. If you have any questions, please feel free to send us an email, but we do hope that you'll attend the CARE conference coming up at no cost. We also provide free CEUs, and thank you all for the work that you're doing in California, and especially during these especially difficult days of 2022. Thank you, Mego, Kristen, and Sylvia, and thank you to Dr. Joyce Chu and her phenomenal team. Take care, everyone.